Hello, everyone, and welcome to our Ask the Doctor session today on keeping in shape with Parkinson's. My name is Shelley Korean, Executive Director of Skypass Foundation, and I hope all of you are keeping safe and healthy. We also have Dr. Shilpa Chitnis here with us today. Dr. Chitnis is a professor of neurology and a movement disorder specialist at UT Southwestern, and also sits on the board of directors for Skypass Foundation. Now I'd like to introduce you to the star of the evening, our speaker for tonight, Dr. Michael Brach. Dr. Brach is a licensed doctor of physical therapy and specializes in treating patients with PD and other movement disorders. He has quite a fascinating background in amateur fighting and kinesiology, and his programs are targeted at helping people with chronic and progressive conditions move and feel better. He founded Tribe Wellness in 2017 and is here to teach us how to keep in shape with Parkinson's. So please welcome Dr. Mike. Mike, take it away.
Hi, everybody. My name is Mike Brach. I'm a physical therapist. I've got a clinic here in Richardson, Texas called Tribe Wellness. As all of you know, with or without Parkinson's, it's really hard to consistently stay active by yourself. But with a group of people, it's a lot easier because there's more consistency, there's more encouragement, there's more of a sense of community. So we call our company Tribe Wellness because we really like to use a different approach. We like to use physical therapy as a way to try to boost someone's ability to participate in the group, and then the group can be the mainstay of care. So think of it more as the group is the primary goal, and then one-on-one therapy is like a tune-up. And so we've got a lot of different group programs here at Tribe Wellness. I feel really fortunate because I get to teach a lot of non-contact boxing classes. I need to emphasize it's non-contact because a lot of times when we talk about boxing and Parkinson's, people think, well, hang on a second. Didn't that cause some problems for Muhammad Ali? I remember the '96 Olympics and seeing him with the torch. And we do know that head trauma certainly can accelerate symptoms. We don't hit each other. We just train, and we have a great time doing it. We also have a bunch of Tai Chi programs. We've got yoga for balance. We've got a balance and core class. We've even got a hiking group that participates in a regular hiking and walking program. And then we go out as a group to take on a challenge. So that way we've always got something to train for, something big to work towards, and we get to have a lot of fun doing it together. My hope tonight, though, is to go over some ideas with you that are critical to using exercise as a tool to manage symptoms. And I can tell you that, as I'm sure you know, exercise is medicine for everyone. And for people with Parkinson's, it's even more important because exercise is really the only thing that's been shown to have any possibility of slowing the severity of symptoms. Meaning if there were two versions of you, one of you exercises, one of you doesn't, the one that exercises has a much better chance of hanging on to function, perhaps even improving in some areas of life, and if nothing else, having a better time, because exercise can certainly impact all of the motor symptoms, or I should say not all, but most of the motor symptoms with Parkinson's disease. Also, as you know, when you're working out, you're less stressed out. Every system in the body is working more efficiently. So it also plays a key role in helping to positively impact the non-motor symptoms. You know, those things like depression, anxiety, even sleep disorders to some degree. That's not to say exercise is here to replace your medication, but I do think people who work out and take positive action physically to manage their symptoms, they often report that their medication feels like it's working a little better for them. Or if nothing else, they often report that they're having more fun and enjoying a better quality of life than they were when they were sedentary. And that goes for a lot of reasons, but I think the big idea is Parkinson's, more than other diseases, has such a powerful and profound mind-body connection. Meaning if you're physically stressed, you experience kind of a short-term spike in symptoms. Also, as all of us know, in this unusual time with COVID-19 and everything going on in the world, if you're feeling any emotional stress, it can certainly also ramp up symptoms a bit. So exercise is just one really important tool to help. And so I don't think we'll get through everything possible, but I sure hope that by the end of the night, you've got some key tools that you can use to take charge of your own symptoms. I went to a great webinar over the weekend for another national Parkinson organization, and there was a lady who was an ambassador speaking, a patient with Parkinson's. She said that for the first year after she was diagnosed, she felt very fortunate to go to a bunch of different support groups and to connect with a lot of different people. And somewhere deep down, she was kind of thinking over and over that she hoped she could just find the right source of information that would help save her from what she was going through. And she kind of blew my mind, and she blew a lot of people's minds in this presentation, because she said at some point in time, she realized she's the one that she was waiting for to save herself. And that's to say, we've all got the ability to do well. We've all got the ability to live well. And some of that comes from just looking what's within my scope of control, what can I change, and how can I do that? And exercise is certainly something that is available to everyone. We just need to find the right combination for each person. I love that aspect of my job. So I've got some disclosures, and I'll kind of fly through them. One is that obviously I'm highly biased because I do this for a living and I love it. So of course I'm going to talk about the positive sides of this. Also, just because we're talking about it doesn't mean that everyone should do it. If you've got other health conditions or injuries, I'm sure we could find a way for you to exercise, but it doesn't mean that you should do every type of exercise. And I'm really hopeful before you start anything new that you got a really good care team, someone that you live with or you care about, who cares about you, a great movement disorder specialist like Dr. Chitness, PT like me or somebody else that's a PT in the area, an occupational therapist perhaps, and maybe even some sort of counselor or neuropsychiatrist or neuropsychologist that you can also bounce some of these ideas off of too. I think those are critical components in a successful care team. So I hope if you start anything new, you just run it by them. Also, there's so much great research out there about exercise and Parkinson's disease that there's no way in one presentation we could cover all of it. So we got a few highlights, and then I'll pull out a few key concepts, but hopefully we get to have a good time. And certainly if you have more questions or concerns when we're finished, hopefully just let me know, because I really want this to be a meaningful use of your time. So today we're going to go over some concepts of how exercise can help. We're going to go over some basics for strength, for flexibility, for balance. When it's all said and done too, I'm sure we can get you a copy of the slide. I'm sure we can get you some of these things for resources. But before we jump too far in, I also want to remind you, as a licensed physical therapist, when I work with people in one-on-one therapy, it's less about, hey, are you active in your everyday life? And it's a lot more about, for your specific needs, for your specific areas of balance that are most impacted, or the specific elements of your walking that are most impacted, or joint pains that you might have that are worsened by Parkinson's disease. How do we come up with a really customized plan for you? So I think everyone with Parkinson's disease should be active, but also I want you to remember that physical therapists are movement experts, and we're out here, we're available, and we're happy to help you, whether it be for an annual tune-up, or if you notice some symptom of yours has gotten significantly worse, or some aspect of your balance, or maybe you feel a lot weaker in your legs, or your posture is really changing. Those are things that we can work on with you. If you're starting to fall, please, before you try a group exercise program, get to a PT. And whether it's working on your walking mechanics or your balance, there are all kinds of ways we can help you out. So, it used to be people kind of waited until things got what they thought might be bad enough, and then they went to physical therapy. And I'm so glad that things have changed with how medical management of Parkinson patients works, and how my industry, our whole healthcare industry, and my field of physical therapy has changed our approach, because now we know so much more about the preventative role of this, in terms of if you don't get too far behind and you stay current in physical therapy, you can better participate in groups and better participate in daily life. So we'll dig in a little bit to some symptoms. Overall, I don't think any of these symptoms should really be terribly surprising. This is the textbook photo that a lot of people use of what Parkinson's can look like. And if you're like a lot of people I work with in our groups here at Tribe Wellness, you might say, well, that doesn't look anything like me. And I would agree, because first of all, it's a cartoon. But second of all, just because the symptoms are possible with Parkinson's also doesn't mean that you're going to get them. But it's helpful to know that exercise has a significant role in addressing these symptoms. I'm sorry, did somebody have a question already? Maybe it's just a tech thing. Okay, all right. So, obviously things like your tremor, that's more managed by your medication. But certainly exercise and physical therapy can play a huge role in helping you out with your posture, with your balance, with your flexibility, with your coordination and your strength, and especially your walking. So while this is what it can look like, we're going to get into how exercise can certainly help in managing some of that. And we're going to do a lot of activity tonight, or I should say I'm going to. Hopefully you'll join me. And I should also note here that if you are going to join me in activity, I sincerely hope that you're doing it in a way that is both safe and responsible, because I'm not there with you at home. So if you're, a little wobbly, maybe you can do some of this stuff from a chair, or maybe you've got something really sturdy you can hang on to. I just want to make sure that in an effort to gain benefits from exercise, you're not putting yourself at unnecessary risk, because if there was ever a time to stay out of hospitals, this is probably one of them, right? I mean, nobody ever wants to go, but it makes sense to put a little extra caution on things right now. When you look at what literature currently says, it can really be summarized by this slide and this quote from Dr. Daniel Korkos. And a lot of us are here in Dallas, Texas. We've all heard of Dr. Ken Cooper, founder of the Cooper Aerobic Center, who 50 years ago wrote a book called Aerobics. And the takeaway message was, get moving, stay moving, and you'll stay more healthy than you otherwise would. And that was the message 50 years ago. That's still the message now. The difference is we know a whole lot more detail down to the cellular level and the subcellular level of why and how that stuff works. So just like if you didn't have Parkinson's disease, we know exercise is good for every system in your body to work well. But the good news is, if you have Parkinson's disease, exercise has an immediate beneficial effect. And I've seen that. I get to see that all the time in my job. We'll start a class, people will say things like, because of the rigidity that I feel from Parkinson's disease, I'm so stiff, I'm achy, I don't feel like working out. By the end of class, people usually say something like, I didn't enjoy every moment of class, but I'm very glad that I worked out. And that's saying something. That's pretty powerful. And so whether you do this stuff with me or somewhere else, I'm just hopeful you can find some ways and some ways to do this, and some things about exercise and specific types that work for you. Because there's no perfect program, but we do know from things like this meta-analysis. So when you think about like levels of evidence, there's like expert opinion is like the lowest level of evidence. Or you could look at things like a case study or systematic review, randomized controlled trial, and then a systematic review, and then a meta-analysis. So this is a study of studies where they took 18 other research studies of randomized controlled trials, combined all the data from it, and found, wow, aerobic exercise, more so than strength training, more so than balance training, had an immediate beneficial impact on motor action, meaning we've all heard of this term, bradykinesia, which med students and healthcare students memorize because they think, okay, Tom Brady, the quarterback, he's not the fastest quarterback. Kinesia is movement. So maybe this is slowness of movement. Aerobic exercise instantly or nearly instantly impacts that slowness of movement. Also, it can have a profound, immediate beneficial impact in balance and in gait, which is the fancy term for walking. And that's all specific to people with Parkinson's disease. So there's certainly a variety of other studies out there that show similar things, but I think it's really helpful to look at something as powerful as a systematic review and meta-analysis, because this is saying the highest level of evidence out there is showing you that aerobic exercise needs to play a significant component in your workout regimen. And you know, what might aerobic exercise mean? It means a lot of things to a lot of people, but that could be as simple as raking the leaves. It could be as simple as going for a walk at a pace that's slightly faster than your self-selected pace. That could mean hopping on a stationary bike safely and participating in a cycling class. It could mean a lot of things. I'm very biased with the stuff that I teach, but hopefully the big takeaway here is aerobic exercise is incredibly helpful for a lot of reasons. And the biggest reasons that research shows for intense aerobic exercise, moderate to intense aerobic exercise, is really nicely linked with slowing the progression of symptoms. And that's a result of important hormones that are released more heavily into the bloodstream that are linked with all kinds of processes for nerve repair, neurogenesis, or strengthening connections in the brain. Things like BDNF, which is brain-derived neurotrophic factor, or VEGF. And we don't have to get into all of those, but there are a variety of hormones that are released that help strengthen connections in your brain and help improve a lot of the different motor symptoms associated with Parkinson's disease. And the force behind all of that, the force that's driving all of that, is a really fancy term. It's called neuroplasticity. And that's a fancy term for making lasting changes in the brain. There's a lot of good research out there on neuroplasticity and on exercise-induced neuroplasticity, meaning when you exercise, it's easier to make powerful and lasting connections or changes to strengthen connections in the brain. So where, for example, a lot of research compares things like Alzheimer's disease and changes to the brain versus Parkinson's disease and changes to the brain. If you strengthen connections, a way to look at Alzheimer's is like if your brain is a computer. With Alzheimer's disease, maybe you're trying to open up a program like Microsoft Word, and a different program loads up, like PowerPoint, for example. Or if you compare that to something like Parkinson's disease, you're not going to load up the wrong motor program, but it might do so much more slowly. And when you think about strengthening connections in the brain through exercise or repetitive practice, it makes it easier to maintain those connections. And often it can make it easier to load those motor programs more efficiently. So if you think about a movement in the body being a program, and if you think about the brain being the computer behind it all, neuroplasticity can help you strengthen those connections to really hang on to what you've got and perhaps even improve it, or to slow the worsening of this stuff. And it does it through some key concepts. We won't get into a lot of, usually when I say use it or, and then I stop talking, people scream out at once, lose it. And that's one form of a concept of neuroplasticity. But also, you know, from living life, the more you do something, the easier it is to do. So you can use it and improve it, despite Parkinson's disease in a lot of cases, especially with balance. You can use it and improve it. Even if you've lost a lot of balance, with a lot of practice and guidance and oversight, as long as this practice is safe, you can still make improvements to your balance. Specificity of task makes a big difference too, meaning if you're struggling with walking, probably not going to be as helpful to work on reaching activities or pushing activities or pulling activities. If walking is your biggest concern, the more specific you can get to your walking for your repetitive practice and your training, the better. Repetition matters, and that's one thing I love about boxing, and I love about Tai Chi, and I love about martial arts training in general, because as a physical therapist, many of you have done PT before, and many of you have heard somebody say, do 3 sets of 10 repetitions of this exercise. But we know as long as you're not causing an overuse injury, the more you do something, the easier it is to do. So with martial arts training or with boxing training or Tai Chi training, we do things over and over and over and over. And that way, you've got one more chance each repetition to get a little bit better at that task and strengthen those pathways. Intensity plays a big role and in exercise-induced neuroplasticity also, which is number 5 here on the list. And the key thing I want you to know about there is for intensity, it doesn't have to be so intense that you feel like you can't function for the rest of the day. It doesn't have to feel so intense that you feel like you've got to set a personal record every day. But the same benefits in a lot of research studies can be derived from moderate intense exercise as they would be from highly intense exercise. So any time moving counts, and any time moving is better than no time moving. So please, my request of you is to make sure that you're making the most of your time by not waiting around for the perfect program, and instead taking action, doing what you can, and modifying your program along the way with the help of experts. Time matters, meaning the time on task. That's stuff, you know. If you were learning a new musical instrument or a new language, obviously 1 or 2 repetitions probably wouldn't be enough. And even if you didn't have Parkinson's disease and you were learning Tai Chi with me or from one of my many teachers, they would tell you, for example, my teacher's teacher is a guy in Baltimore, Maryland. He's got a title of Grand Master. His name's Grandmaster Wong Chen Liang. He's a 64th generation Grand Master of our style of Kung Fu and Tai Chi. And he would tell you that he is still practicing, meaning it takes a lot of time to get really good at something. But if you can really fall in love with the process of training, it doesn't matter because the time flies. And if you don't fall in love with the process of training, hopefully you got a group of people to have some fun with along the way, so that way you can stick with the training and keep going. The next term there, salience, is it's kind of a tricky one. It just means, do you like what you're doing? And so people ask me a lot of times, what's the best exercise for people with Parkinson's disease? And at the risk of sounding incredibly vague and dull, I'll say something like, well, the kind that you will do both consistently and safely, because that's a lot better than doing nothing. And that's better than having a flawless plan that's made for you that's so boring or that you just don't want to do. I've got on here the other principles like age matters, and all that means is over time, it's harder to make lasting changes in the brain. I don't say that to discourage you. Rather, I say that to encourage you to know that changes can still happen. It just might take more time or more repetition. And all of that probably makes sense too, because if you think about, if your kids or your grandkids were learning a foreign language and you were learning a foreign language, well, sure, the grandkids are going to soak it up much more quickly because their brains are more malleable and more plastic, meaning more able to make lasting changes. Doesn't mean you can't learn it, just means you're going to need more repetition and time. Interference can get in the way because there's maladaptive learning, meaning if you do something that's not helpful, if you do something incorrectly over and over, it can get in the way of doing something correctly. I don't find that to be as big of a deal in what we do, but it's worth noting. And generalization means, we could take things like, for example, we're going to do some squatting tonight. It's going to be great. If you want to join in, we can do some squats in a moment. But you might say, well, why on earth would I do an exercise like squats? And if you think about generalization, you can generalize that movement pattern to functional daily activities. Things like getting on and off the toilet, getting in and out of a chair, getting in and out of a car. So the more you can find things that you like to do that closely match things that you're having trouble with and closely match things that you need to or want to do in daily life, the better you're going to be able to make use of your time exercising. So that's a whole lot of me rambling. And you might say, how do I get from this cartoon textbook Parkinson man to mean and tough looking like my buddy Steve in this picture? And he looks tough because he is. He is one tough dude. And you can get that way through working out. And this is just one more plug for what we talked about with intensity. This study from 2014 found that folks who were doing high intensity aerobic exercise for 32 weeks, that's a lot of weeks, they found improvement in both the motor symptoms associated with Parkinson's disease as well as the non-motor. So things like physical movement as well as mood and cognitive function. And that's a big deal. And that same benefit that's available from high intense exercise, more and more research is showing is also available from moderately intense exercise. So you don't have to go all out, full sprint every time. In fact, some people I see when they're first getting active tend to do that, and then they run into a few problems where they've worked so hard that they have trouble the rest of that night, or the next day they almost feel like sick, and it's because they've overdone it. It's an extreme version of something like muscle soreness. It's an extreme version of what can happen when you overdo. So my suggestion would be, if you're new to exercise or if it's been a while, start out somewhere in the middle, get consistent, and then gradually increase that intensity over time. When you think about what's a perfect exercise program, it will have key components like this: flexibility, balance, strength, and at the heart of it all is going to be some degree of intensity. Now, how can you get there? Many of you have done things probably like the LSVT BIG program or the Power Moves program, Parkinson Wellness Recovery, or perhaps you've just done physical therapy or been on a walking program. Any of that stuff is helpful. But what can also be key is if your balance is really off, adding some weight shifting can be huge, because if you can't weight shift, you can't walk. Big dynamic movements are a big deal, because if you think about the part of the brain most affected by Parkinson's disease, it's the basal ganglia. The basal ganglia is responsible for, among other things, starting and stopping big movements. So that means a lot of folks that I see come in, and if they're not focused, they're doing small automated movements. Especially in boxing class, they're doing little punches like Bruce Lee, which isn't so bad. I mean, he was a tough fighter. But what we want to do to try and fight some of that rigidity, to fight some of that stiffness, is big dynamic movements where you're really reaching out and back, moving in multiple directions, multiple planes of motion. And because a lot of times people experience stiffness in the thoracic spine, their mid-back, and that's common for everyone as we age. And many of the motor impairments with Parkinson's disease closely mirror those of normal aging. They're just more pronounced, and they tend to happen at a more accelerated rate than normal aging. The more you can get axial rotation, where you're getting gentle twisting through the spine, the better, because that can help, almost like putting WD-40 on a rusted screw or bolt. It just makes it easier to get moving. So again, I want to remind you, for intensity, I like to use this Borg RPE chart, and that's just a name for rating of perceived exertion scale, where you say, how hard does it feel like I'm working? When people are new in my classes, or if they're in our research study that we've been running for the last 3 years with boxing and Parkinson's disease, every few minutes, I like for them to check a chart like this to say, if 0 is like I just woke up from a nap, and if 10 is my maximum effort where I could not continue, hopefully you can arrive at a 4 out of 10 during your workouts and stay somewhere between a 4 out of 10 and a 7, maybe an 8 out of 10 on the top end. If you feel like you're up in the 8 out of 10 intensity level, it's time to start backing it down just a bit, so that way you can make it through the whole workout without really feeling like you've overdone it. And what's nice is over time, the body adapts to regular stress that we place it under. So over time, you're able to do more and more and more before you reach that 4 out of 10 or 6 or 7 out of 10. So I do want to remind you, work hard, but don't overdo. There is such a thing as overdoing. For intensity, here's a list of different stuff you can do. But the general idea is to think of cardio, meaning exercise that gets your heart rate up a little bit. Some people like to use age-adjusted maximum and target heart rates. Some of the people I see, though, are on medication like beta blockers that limit their top-end heart rate. So I really prefer for people to use that intensity scale of just 0 to 10, how hard does it feel like I'm working? But you can look at any of these types of activities. For kickboxing at the bottom, I put maybe, because I hope if you're doing kickboxing, you got really good balance first. But any of these things can be helpful. And for intensity, why don't we just try for a little bit? I'll warn you, I can't see you. I'm not at home with you, but perhaps we can try a few things to do some intensity. I always like to do some boxing training. You don't have to, but maybe you can see how neuroplasticity works a bit. And you could see it by, if you're at home and you feel safe and you feel like your balance is okay, standing up, or you could stay in your chair and do this. We can get 1 foot forward a little bit. We can get 1 foot back a little bit. We can bring the hands up to about cheek level. We can keep the head up and the back up straight. And we can get our feet about hips width apart. And right here, you can already see it's important to have a good fighting stance, because then you're upright. Your back is up, your head is up, your hands are up. And if one of the things we're fighting with Parkinson's disease is this posture, it sure is helpful to have that cue of keeping your hands up. I've got my left foot forward. That means my left hand is my front hand. And the easiest punch to start with in boxing training for any fighter is the jab. And that's where you reach out and you pull back. Reach out and you pull back. Make sure you don't punch your computer. Make sure you don't punch anybody around you. But you can see how already, if we're just reaching out far and pulling back up high without any fancy equipment and without getting too crazy, we can work on functional daily activities like functional reaching. And we can work on minimizing some of those things like those smaller automated movements that come with Parkinson's disease. Because we can focus on using your reach, and we can put intentional focus on bringing those hands back up high each time. And when you're punching, it's easy to get your heart rate up, maybe even a little bit more so than if you were doing just work with your legs. If you were in one of my classes and we had a punching bag, you'd also get some planned balance, because you know you're going to hit something, but you'd have some degree of reactive balance control that you're training, because that punching bag is going to bounce back at you a little bit. So we've got the jab with the front hand. From the back hand, the other hand, we can reach out across the body and pull back for a punch that's called a cross. So they're both straight punches. The jab is the front hand. We pull it back. The cross is the back hand. We can pull it back. Every time we're bringing those hands back up to cheek level, and every time we're making sure that back's up straight. A lot of boxing coaches will call the jab 1, and they'll call the cross 2. And so then they'll say things to add like a cognitive component of 1, 2, reset, hands up. 1, 2, reset, hands up. And we can work at a different cadence. We could say 1, 2, 1, 2. Or we could go slower, 1, 2, 1, 2. Or we could have a little bit of a brain challenge and say 1, 1, 1, 1, 2. And see if you get caught. And there are a lot of different punches we can do, but you can see how if you were doing a punching combination for a period of, I don't know, 2 minutes, you could really get that heart rate up. You could really dial up that intensity, and you could add a cognitive component to it. So when you think about intensity, again, that could be as simple as going for a walk. It could be as simple as hopping on a recumbent bike or an elliptical machine, a rowing machine, or it could be going to a boxing class. It could be raking the leaves, for goodness sake, but you got to do something, and something that gets your heart rate up. For strength, what I've got on here for you are obviously some ways you can build strength. And you see on there, we got free weights, we got weight machines, we got body weight. So already 3 things are using one term of weight, meaning resistance, meaning you get stronger by putting your muscles under tension for time. It doesn't mean you have to be a power lifter. I grew up watching some guy named Magnus Ver Magnusson, the world's strongest man, and he was pulling these jumbo jet planes on a rope tied to him and hauling it down a runway. And I remember thinking, that's what strength looks like. And then I remember growing up and thinking, I don't know how that man's back or shoulders or hips or knees work. But you can do any of these things. You can even do body weight exercises. And so when you think about what are muscles that are chronically weakened from normal aging or more accelerated by motor impairments with Parkinson's disease, here's a general rule to follow. If they're muscles on the front of your body, they're usually tighter from postural impairments associated with Parkinson's disease. If they're muscles on the back side of your body, they're usually stretched out and weaker because of postural impairments associated with Parkinson's disease. So here we've got one of my lifetime heroes, Jack LaLanne, the godfather of fitness, the first person to ever charge a membership for an indoor gymnasium, and people thought he was insane. They also named an exercise after him called the jumping jack. Jack LaLanne here is showing you what it can be like to age well in a strong manner. But if you look at this list of muscle groups, a lot of them are muscles that reside between your shoulder blades. And that helps to draw the shoulder blades back and push the chest out. Also, if you look at the next part of the list, there are muscles in your legs. And that makes sense because all the major muscle groups in your legs should be strong because we don't walk around on our arms. We walk around on our legs. Also, your core can always use some attention, and there are a lot of ways to do that. So when we think about strength, let me show you a few easy things you can do at home. And at home, I'm so hopeful that when you do this stuff, if you do this stuff, you do it in a safe manner. I'm hopeful that you'll do this stuff in an area that doesn't have cluttered floors where you could trip on something. I'm hopeful you'll wear appropriate footwear like shoes and not slippers or socks. But one thing I like to do in our groups, we say we've got a sweet tooth for squats. because squatting is an exercise that uses a lot of muscle groups in the legs, and it's very functional. I like to take something like a chair like this, line it up against the wall, so that way it's got some sturdy support. I like to have people get right in front of it and get their feet about hips width apart with the toes straight ahead. And if you've got a chair with arms on it, you can hang on to the arms a little bit and sit back down and stand up. And that's easy. But if you did a whole bunch of them, you get stronger and stronger in your legs, and that makes it easier to get up. This, of course, assumes that you've got enough balance and strength to be able to do this unsupported. If you don't, you might use something like, I've got a railing here, but a lot of times people at home when they're squatting, they might not have a sturdy railing like this. They could put their hands on the inside of a sink, as long as that sink is dry, you haven't just done the dishes. But that way you can hang on to the railing and sit your bottom back and stand up and still get some support. Over time, as you get stronger and stronger, you don't need to hang on as much. Now, if you're able to do this unsupported, another great way to involve those muscle groups we were talking about between the shoulder blades, it's really simple. As we stand up, we can push the back of the hands back and squeeze the shoulder blades together. So you're sticking your chest out. So we sit down, stand up. Let's just do 10 of them. This will be awesome. Here we go. We'll sit down, and as we stand up, we'll push the shoulder blades back and down. We'll sit down and stand up. Sit down and stand up. Isn't it great? And as you squeeze those shoulder blades together at the back, you can kind of look up and push your chest out. You can add a pause at the top to really squeeze those muscles between your shoulder blades. And I think you can feel how that helps to mitigate or to positively impact that rounded shoulder posture that gives people a lot of trouble. That's not necessarily as big of a problem with balance as you might think, but it certainly is a big problem in creating neck pain and shoulder pain, and eventually it can impact your balance. So that's one easy one you can do. Another one you can do that we just can't get enough of in physical therapy are heel raises. What does that mean? Well, heel raises, again, hopefully you got something really sturdy you can hang on to. Heel raises really work your calves. And the gastroc muscle, your calf muscle, is probably the most important muscle when it comes to your step length and your walking speed. So what I like for people to do is to hang on to something lightly, to push their heels up high, and to lower slowly. And in my mind, I don't think you could probably do too many heel raises. A good place to start is probably sets of 10 or 15. And where a lot of people run into trouble is they rise up and they kind of flop around. But I'm hopeful you'd be able to rise up on the toes and slowly lower down. If it's easy for you to do 15 or 20 of those, you might do some single leg heel raises. And in physical therapy, when we do muscle testing, we like for people's calves to get so strong that they could do 25 consecutive single leg heel raises without sacrificing quality. So like if you were going to be trying to run again after a surgery, or if you wanted to achieve the maximum score for calf strength, 25 in a row, good ones with one leg. It's a good goal to have. Maybe get there, maybe you don't. But the good thing about goals is it gives you something to work towards. So for calf strength, that's a big deal. There's one other easy thing you can do to work on rotator cuff health and to work on those muscles in between your shoulder blades. There's a popular exercise you can do where you keep your elbows in. I've got a resistance band here. If you don't have one, that's okay. There are a lot of other ways to do this. But if you do, it's easy to do this from a seated position. I've got my palms up. I've got this band here in my palms with my thumbs out away from me. And what I'm going to do first is set my shoulder blades back and down. I'm going to pull the band apart and then let it back in slowly. And what this does, if you can squeeze the shoulder blades back, pull apart, and let it in slowly, is that's really activating muscles between the shoulder blade here, mid-trap, to help set the shoulder blades back. It's working powerful rotator cuff muscles. There's an external rotator that's often torn or partially torn just from living life called supraspinatus, and that's a muscle that's responsible for external rotation. So this is an exercise where if you could do 30 or so good ones with good control on the way back, that'd be fantastic. If you wanted to work supraspinatus and you didn't have a band, you could use, I saw Dr. Chitness pumping some iron moments ago here on the video. You could use things like these little weights, or if you don't have free weights, you can even use a can of soup or a bottle of water. You can get creative at home. But one key is first sitting up tall, bringing the shoulder blades back, and then not straight ahead, not all the way out to the side, but somewhere in the middle, like making a letter V, and then lowering down slowly. So you bring the arms just up to shoulder height, you lower down slowly. If you add that 1 pound or 2 pounds of weight, we're doing this shoulder flexion in a plane called scaption, which is such a cool thing to say. It really means we're making a letter V instead of a letter T, or instead of raising straight up in front. So you can do a lot for shoulder health with strength. I'm going to get back to the slides here for just a moment so we can look at things like flexibility and balance. And my hope with this stuff is, by giving you these lists of exercises or these lists of muscle groups, if you know anybody that's big on working out, or if you wanted to use some other resources to track down ways to work these muscle groups, you could. So we've just done that. Let's think about flexibility. Earlier I said from a postural standpoint for aging well, general rule is muscles on the back of the body are weak, muscles on the front of the body are tight. And in PT, we love to stretch what's tight and strengthen what's weak. Here are a lot of ways that you could work on flexibility. I absolutely adore Tai Chi for that matter, because with Tai Chi, you can work on flexibility as well as postural control, as well as balance. And there's a really good cognitive component to it. Also because we move slowly and we focus on controlling the movement with the speed of our breath. There's a really good meditative component to it also. I've got a lot of videos on that you could access on our YouTube channel for free. When the weather's good and when we're not socially distancing, I do a free class almost every Saturday at Clyde Warren Park. That's a lot of fun. You can find a lot of ways to do Tai Chi, but you could also do yoga or Pilates or even just plain old stretching. And if you think what groups of muscles are really tight, well, probably on this guy, this Shaolin monk doing the side splits, not a lot is tight. But if you're like most people I know, muscles in your neck and shoulders, muscles on your chest, like those tight pec muscles, can really help tighten things down. We want to open those up. And muscles in your legs, in particular, hip flexors, those muscles on the front of the hip. And then people often just above the back pocket area have a tight muscle group called the piriformis, which is linked with a lot of back pain and things like sciatica. And a lot of times I find that people, even when they're younger, have unbelievably tight hamstrings, and that just worsens with age and with inactivity. So I always like for people to stretch those. I want to show you a few basic stretches. Maybe you can do them with me. I know we're flying through time here. But if you're sitting in a chair, this is one we can do together. We can stretch our hamstrings together. I'm hopeful that you can scoot towards the front of the chair. So that way, like I'm going to kick my right leg out, for example. The goal, somewhere along the way, a lot of people got an idea from maybe a gym teacher that they needed to touch their toes, and that's not helpful. The goal when stretching the hamstrings, those muscles on the back of your leg, is to straighten out the knee, and I've got the heel down and the toes up, is sit up tall and tip forward here. And that way you feel a nice stretch on the back of the leg. Stretching the hamstrings, really helpful for knee pain, really helpful for back pain, really helpful for just improving flexibility overall. And you might say, well, how long should I stretch? Most people that are stretching, I find, just don't hold it long enough. And there's a lot of physical therapy research out there that says the way to make a lasting change in the length and tension relationship of muscle tissue is 90 seconds of time under tension. So you might do 3 rounds of 30 seconds and think, man, I can't hold for 90, so I better break it up. That's fine. You might do it for 90 seconds because you're a masochist. That's okay too. And you don't have to go so far you feel like things are going to snap, but somewhere that's just slightly uncomfortable where you feel like you're getting a good stretch is a great place to start. Another great stretch I like for people to do for posture and for their hips is a common one in yoga. It's called Warrior 2. And in yoga, you see people do it where they take a big step out. They've got one leg pointing straight ahead. They've got the other foot pointing 90 degrees away. Their front leg is bent. Their back leg is straight. Let me try to get where you can see my hips here. And then they reach out. For people with Parkinson's, I love that stretch, but what I love to do, since people with Parkinson's are often fighting this forward flexed trunk, is I like for you to get near a wall so that way you're not going to tip forward into it. So get close to the wall. You take a big step out to the side, bend one knee, straighten the other, reach out, shoulder height, and then squeeze those shoulder blades back and down. If you're doing this correctly, the front leg is working on strength, especially in that quadricep region. The back leg, we're stretching out the hip flexors, and we're stretching out adductors of the leg, which get tight. And by adding this arm component, we're pushing the chest out, squeezing the shoulder blades back, and looking off into the distance, which even stretches out those tight muscles in your neck. You could hold this one for a couple minutes in one direction, and then you could stand up, point one foot straight ahead from your back leg. You've got a new front leg now where you're reaching out and stretching the other way. This is such a rewarding stretch. It's easy to do. You don't need any equipment. Do it for a couple minutes in each direction. And you could even get a bunch of videos or tips on it. It's called Warrior 2. Simple. For piriformis, that muscle that's linked with sciatic nerve pain, this is probably the last thing we'll do here so we can get to some questions. If you're sitting at the edge of the chair again, as long as it doesn't hurt your hip or your knee, you might cross one leg over the other at the knee. Draw the toes up, sit up tall, and then just tip forward a bit. So you're kind of making you're kind of crossing a leg over like you're hanging out having a conversation, but it's just slightly more pronounced as opposed to being here. You got the ankle right over the knee, sitting up and tipping forward a bit. If you're doing it right, you should feel it just above the back pocket And you might, depending on how tight your hips are, feel it along the side of the hip. And that's a great one to do, again, for 3 rounds of 30 seconds on each leg or 90 seconds on each leg, as long as it doesn't hurt your hips, your knees, or your back. If that's too much, you might just hug a knee towards your chest, or you might kind of cross a leg over and try to see if you can hug something up towards your chest. There are a lot of ways to get after it, but that's a great way to open up some of the tension and tightness people feel in their low backs. In my experience with people with Parkinson's, a lot of times the pain you feel might be related to Parkinson's. It might also, though, be just linked to aches and pains from normal aging that are worsened by Parkinson's symptoms. So a lot of times if you can stretch these muscle groups out, and if you can stretch out tight pecs by getting in a doorway, getting your forearms along the frame of the door, and stepping one leg through to really stretch these muscles out, things can just go a lot better. We're going to fly through a couple quick slides here since we've gotten to try some flexibility stuff. But overall, this is a great thing to look at for tight and weak muscles. We've talked about them already. For balance, the general idea is practice, practice, practice. Get to a point where you're slightly uncomfortable, but still safe. Maybe that's weight shifting. Maybe that's single limb stance activities. Maybe you get a wobble board or a balance board. Perhaps you try something with a lot of direction changes. Dance for Parkinson's is a very big concept that a lot of people get a lot of good out of. Same with the big program, power moves. Same with boxing and Tai Chi. But the general idea is for balance training, if your balance is suffering, the key is finding ways to work on your balance in weight-bearing positions, meaning if not sitting in a chair as much as standing up and supporting your body weight against gravity. If that is doable in a safe way, then adding a lot of direction changes where you're controlling that is a very big deal. And the reason Tai Chi is so helpful, one reason is that slowness of movement doesn't flare up a lot of joint pain. It doesn't flare up a lot of aches, but also it requires a lot of control that faster movements and momentum can mask. So one big theme for balance, though, is to keep your base of support or to keep your center of mass over your base of support. If you're far beyond your limits of stability, it's easy to tumble. One reason I love Tai Chi also, though, is a big problem with balance isn't necessarily related to posture with Parkinson's. A big problem with balance is more related not to the dopaminergic system, but the cholinergic system. So related to the ability to do two things at once, linked to executive function, thinking. And another way people will say it is, my balance is okay as long as I know what I'm doing, but the moment I have to make a quick turn, I get off balance. And things like Tai Chi and dancing force you to think about the technique or the movement, and that makes it a lot easier to boost that dual task ability and the cognitive load that you can handle to help with that direction changes and maintaining balance during daily activities. I've said kind of a lot here. I think our man Jack LaLanne could summarize it by saying a famous LaLanneism, it's not what you do some of the time that counts, meaning if you ran a marathon 30 years ago, that's awesome. That may not be as helpful as what you're doing right now. It's what you're doing all the time that really counts. And so hopefully you can take some elements of what we've been doing tonight and apply them to your everyday lives and to your everyday routine. Or maybe just turns you on to other resources and other activities that can help you do that, because consistency is king here. That's my dog, Junior. I put him in there because he's adorable and I love him. And also he's our mascot for our boxing group, and he's often here at the gym with me. He's in fact taking a nap in the office right now while we're talking. If you've got questions or concerns that we can't get to tonight, this is in the slides. You can even find all my info on tribewellness.org, or I'm sure the good folks here from the Skypass Foundation can handle a lot of this stuff. But with that, I want to check and see what we've got for questions, and I want to see what we can do to get you the answers you need.
Thank you, Mike, so much for that valuable information. That was excellent. Just a reminder, if you have any questions, please feel free to type those in the chat box. We just got one. It says, Mike, are you doing boxing classes on Zoom?
Yes, I am. Info about that is on our website. We do charge for those, provided you're in a position where you can pay and you can get info. I've got them. A lot of groups have them. And if you want to do it with us, great. And if not, maybe you can find other ways and other groups to exercise with. DAPS has a lot of classes locally for exercise. Also, the Finley Ewing Center, when it's open, has some great classes for exercise. We're lucky in Dallas. There's so many resources.
Awesome.
What else you got?
One of the questions that was emailed in was, are there any specific exercises that you recommend for non-motor symptoms?
Ooh, that's a good question. So non-motor symptoms, I guess it depends on the symptoms themselves. If stress, for example, is a key non-motor symptom, or depression and anxiety are non-motor symptoms that are really causing a lot of trouble, well then mindfulness practices and forms of exercise that employ mindfulness practices are a very big deal. And so for that, you might look into things like Tai Chi, because there's a meditative aspect, or you might look into things like yoga or Pilates. There's one I put on the slides called Feldenkrais, which is more about like free-form moving. It was big in the 60s and 70s. But anything that focuses on your breath and body awareness, that can help train more of a relaxation response compared to like a hyperactive nervous system that's got a fight or flight response, which is accelerated by anxiety. So you can kind of slow down that anxiety, and you can have a positive impact on those stressful symptoms. I do want to say there still might be plenty of space and plenty of need for medication in addition to exercise. I think that's fair and often overlooked. And a lot of times people forget that asking for help there is a way of strength. It is not a way of weakness. But aside from that, for non-motor symptoms like bradyphrenia, slowness of thinking, certainly aerobic exercise helps for a number of reasons. One is it boosts the vascular flow of blood to the brain. Another is it improves oxygenation of the brain, so it can help with your alertness. But just about any type of exercise, if done consistently, can also maybe not entirely fix the problem of things like sleep disturbances, but have a positive impact on it. And so anytime you can get some positive movement there, that's a good thing.
Mike, if I may add, the non-motor symptoms, I think, so I'm going to pick anxiety, depression, apathy, fatigue, pain, sleep. I think all of these can be modulated by exercise. It's important to recognize you cannot eat all your food in one day. You have to start really slow. You have to build it up. I would even give, 2 months to build up, 2 months versus the rest of your life, and I think it's really important to identify, number one, safety. What is safe for you to do? And I highly recommend for people to pick like 3 or 4 different kinds of activities, because if I love Thai food, but at some point I am going to get tired of Thai food, doing the same thing over and over and over again. I think and as Mike pointed out, and I'm going to turn it over to Mike in a second, as Mike pointed out, I think that it takes time. Initially when you start exercising, you are going to be very fatigued. And the important thing is to motivate yourself to plug on. And that's why you have to start with low impact exercises. And I'm not an expert on exercise like Mike is, but you don't want to tear your muscle. If you tear your muscle, you'll be eating a lot of Advil, you won't be able to exercise for 2 weeks. And then, rotate your muscle groups, because you don't want to do the same muscle group every day. You want to rotate, right? So consistency is important. Building up is important. I think swimming is a really good exercise. Mike, what do you think about that?
I think swimming's great if you've got access to a pool and you got a lifeguard there. Your points are very crucial. Of variety is a big deal, and more than anything, consistency and safety. So, for example, when we've run our research study in the past for boxing, usually people that join us haven't done much in a very long time. And what a lot of people in those groups have said to me over the last few years is, if they can stick with it, usually after about 3 or 4 weeks, they start to notice a pretty big change in their confidence. They start to notice a big change in how they move. And that matches up with a lot of strength and exercise science research of even the ability to recruit muscle fiber improves dramatically after about 4 weeks of a new activity. For more lasting changes down to the cellular level, though, we're still looking at 8 to 12 weeks. So it's, exercise is medicine, but the drawback is a lot of medicine you take and you have an effect within a half hour or so. With exercise, you got to stick with it, but it's certainly helpful.
Speaking of medicine, actually, we got a question in our chat box. It says, can you speak to exercise timing with medications wearing off?
That comes up sometimes, and I think the number one source to turn to there is your movement disorder specialist, because you might be on a variety of different medications. In general, a lot of folks find that if they're in an off period, it is not an ideal time to exercise. So a lot of times people like to try and time their workouts that match up with being maybe a half hour after they take their dosage of medication. Or alternatively, you might speak with your doctor about if it makes sense for you to change the timing of your medication because of your workouts. So for example, if you're really stiff and rigid and you've got a lot of balance problems in the morning, waking up and working out like crazy first thing might not be as helpful as it would if you've already got some medication in your symptoms and your balance is a little better and your alertness is a little bit better. Dr. Chitnis, is there anything you'd add to that or take away from that?
I would say, unfortunately, what happens is, you do have to be very regimented. Like, it does require a lot of discipline. I agree that first thing in the morning, unless, there are some people, remember that there is sleep benefit in Parkinson's disease. There will be some people that will wake up in the morning and for the first half an hour feel really good. And then they take their medication and they feel really crappy. And the reason is that for the first half an hour, they feel really good from the sleep benefit. And then they start to wear off, right? Because if they have not had any medication through the night, and the time it takes for their dose to kick in is when they don't feel very good. So now people who have early Parkinson's disease, that's not a problem, because the brain tends to store, the medication, and there is still some, endogenous dopamine that is remaining. But in somebody that has, had Parkinson's disease for 10 years, you really have to think about, I need medication through the course of the day, but do I also need, a tablet to take, either at bedtime or if I get up to go to the bathroom in the middle of the night, so that when you wake up in the morning, you still have the dopamine. Now, when you sleep, you're not using up as much dopamine. But when you exercise, you are using up dopamine. I have people that tell me that, at the end of the exercise, my dopamine, I wear off, quicker. So that's one thing. The second thing I want to say is, depending on what stage in the disease you are, you can definitely carry like an inhaler, like in Bridger. That's an option. So let's say you're in the middle, and remember that in some patients with Parkinson's, you could have unpredictable wearing off. So you're in the middle of the exercise class, you have unpredictable wearing off. You really need to step away from the exercise, but you could try in Brija, and that, kicks in faster, and then you could do that. But I think it's really, as Mike said, it's all about the timing, and for those people who are working, may not have as much flexibility as those people who, are retired or not working. But yes, I mean, being in the on state would be very good. It would be terrible in the off state. One last word, if I can say, not everybody can do treadmill or elliptical.
Right.
If your balance is not good, please don't get on the elliptical or treadmill. I've seen many disasters in my lifetime. Question?
Actually, piggybacking off of that, our last question that we'll address today is, are there any exercises you should avoid with Parkinson's? Certainly what you just mentioned about treadmill and elliptical if you've got balance issues. Between Mike and Shilpa, any other exercises that should be avoided?
I think anything that drives you to set an intense personal record each time. For example, I know people who are younger who don't have Parkinson's who do CrossFit, okay? And CrossFit has a mentality of if 1 repetition is good, 1,000 repetitions is better. And putting as much weight as possible on for each of those repetitions is even better. And I know some people who have young onset or earlier in their stages of dealing with Parkinson's disease who can still do things like CrossFit. But the mentality of, let me push myself to extremes is very harmful when you're trying to build consistent habits. So I'd say anything where it feels like you're pushing yourselves to the limit consistently, that's probably dangerous, as opposed to something where maybe you're taking more of a moderate approach to build really good, consistent habits, if that makes sense.
Yeah. I would also say, if you're swimming, I'd rather have a family member around. You really don't want to drown. I've had some bad, stories. Thankfully, none of my patients, because I'm always very careful. So, I would just suggest that it's not a bad idea to have a family member, that's what you need. Norman asked a very important question. I was not going to volunteer this information, Norman, because I didn't want to sound like a mumbo jumbo doctor as opposed to a, Parkinson's specialist. But Norman Hopper asks, is using turmeric to fight fatigue and low energy after exercising, what form, powder, capsule is best, and what additives, black pepper, etc., enhances uptake? This is a very interesting question you ask at this time, because I will say, in interest of full disclosure, I have rheumatoid arthritis. I've had it for 15 long years. But if you look at me, I have nothing, no signs and symptoms of it. Because I diagnosed myself, I went into remission very quickly. The one thing that RA has is a lot of inflammation, and that inflammation leads to a lot of fatigue. And, for the past 3 years, for whatever reason, I had a lot of fatigue, a lot of inflammation. I gained weight because I could not exercise. And my husband, he said, we're now in our 50s, we're getting older, started investigating turmeric. And so he came up, and feel free to use this. This is totally safe. And he came up with a concoction where he takes a 8 ounces cup of moderately warm water. He adds to it honey. He adds to it black pepper, lemon, ginger, and turmeric. Okay, these are the ingredients, and I'll say it: moderately hot water, honey, black pepper, ginger, lemon, and turmeric. Just 1 teaspoon of turmeric. This is, I quit working March 17th because of the lockdown, and I started on this drink March 18th. By April 1st week, I was running like a 12-year-old. I started exercising. All my inflammation was gone. Now, this is what I do now. Okay, I've lost 12 pounds. I can do, I did my first ever 5K, which I've never done. I basically can bike for an hour. I can do an elliptical for an hour. I do weightlifting every other day. There is a yoga thing called sun salutation, which I loved but could never do. I can do it now, do it in the morning first thing, and I walk the dog. I mean, seriously. Thanks for asking this question. I was in fact even thinking of trying to do a randomized controlled trial just with this proposal. I mean, and everybody that has tried this, including my husband and other people, swear by it. So again, I'm not a mumbo jumbo doctor. This is my experience. I'm just sharing.
Thank you, Shilpa. Thank you for sharing that. Can you repeat the ingredients of that tea again, just for the benefit of those listening?
Okay, so just lukewarm water, then add honey in it, so it dissolves. Add some black pepper, ginger. You can either add ginger juice or you can fine chopped ginger, lemon, and just a teaspoon of turmeric.
Wonderful. Well, Shilpa, thank you so much for sharing that information. Mike, thank you so much for your time tonight. Excellent information. Again, as Mike mentioned, if you want more information on his programs, he can be reached at tribewellnessllc@gmail.com. If you're on this call today and you are not subscribed to Skypass Foundation, go ahead and send us an email at info@skypassfoundation.org. We can get you on the subscriber list, and that way you'll receive alerts regarding similar talks such as this one and other Parkinson's related programs. But again, that's info@skypassfoundation.org if you want to email in any questions or if you want to receive emails moving forward regarding our PD related programs. Well, thank you everybody for joining. Stay tuned for next time. Keep working on those exercises and we'll see you next time. Stay safe. Good night.
Thanks, everybody.